Mr. Speaker, as the secret waiting lists in veterans health care come to light more and more, I implore my colleagues to include the Benefits Administration in the VA as part of this investigation. I echo Chairman Miller's statement from yesterday's hearing where he told the witnesses, until VA understands that we are deadly serious, you can expect us to be looking over your shoulder every single day. Count on it. I want the Oakland Regional Office to know that I too am serious and will continue to spend my time and that of my staff to correct the claims disaster crushing the veterans in my district. With the help of an ever-growing group of whistleblowers at the Oakland VA, we absolutely will be looking over their shoulder every single day. Claim dates are currently being manipulated by the Oakland VA to improve their backlog statistics. This is a flagrant disregard for VA rules and contrary to the training received by every employee. Because of practices like these, thousands of veterans in my district are not even eligible for the secret health care waiting lists that we hear about, such as in Arizona. Their claims are still pending or are summarily denied on technicalities prior to full consideration. Many of these veterans have more than one claim unanswered. One man in my district has a 36-year-old claim, and his secondary claim appears to have been deliberately sidelined now for 212 days. Despite these facts, the Oakland VA boasts that they have no claims over 125 days old. Meet veterans just like this man every day with claims that have gone on for years. Thanks to a handful of dedicated VA employees working with my office, we've learned that these delays are an engineered disaster designed to control the VA budget in Oakland. By reducing the claim expenditures, Oakland's management has become eligible for bonuses and received them. Withholding benefits for personal gain is perhaps the most despicable aspect of the VA scandals. Veterans' benefits are supposed to be a non-adversarial system. How can that be when employees have financial incentive not to process claims? Doesn't that explain the endless veteran claims with missing records and the staggering delays in processing? It's time to restore the VA to a veteran-centered system with real accountability. Last Thursday, I made public the statements of whistleblowers regarding some 14,000 unprocessed claims at the Oakland office dating back to the 90s, as depicted in this poster. We've since heard that Oakland VA responded by sending a large number of these claims on a swift trip to Manila for scanning. That's Manila, the Philippines. We don't know how many they've sent. We don't really have an accountability for if they were actually sent at all. After sitting untouched for years, the fastest process we have is scanning these files in the Philippines. How many of these veterans have given up on their claims or even died during this period? Were these veterans contacted to say their claims have been located? Indeed, we hear that this budgeting in Oakland has actually gone for new desks, new furniture, and I've even heard spiffing up the director's suite with an upgraded or new restroom. We don't have money in the budget to buy a scanner so that the claims can be processed locally. We have to ship them out of the country. This is the response we get for some cases, almost 20-year-old claims sitting on a desk in a hallway at the VA. That's appalling. On Tuesday morning, urgent phone calls came pouring into my office from Oakland employees who've been working with us who were unable to verify that these files had actually been shipped. They feared that many of them have been destroyed or perhaps hidden once again in a janitor's closet or an elevator shaft somewhere. I made repeated calls to the Oakland office that afternoon to check on this situation. Multiple calls to interim director Mr. Hackney have gone unanswered, and we've yet, that I know of, to receive a response. Every American should be appalled at this broken system. Mr. Speaker, it's time to expand our inquiries to the Benefits Administration as well, and attack these problems from the bottom up while we have the opportunity. Remember, without a benefits rating, our veterans aren't even eligible to get on the secret waiting list at the veterans' hospitals. This isn't just about Arizona. It's almost everywhere within the system. This administration has known about this situation for at least a year, yet we hear what we hear. Only now are we really getting to the depths of the problem at the VA nationwide. With an important national day of remembrance just behind us here in Memorial Day, and now we're coming upon the 70th anniversary of D-Day, the invasion of Normandy, where our heroic troops really started the assault on taking back Europe from a regime that was evil? Why can't we, the way they marshaled those resources to do that huge invasion, marshal the resources in this country now to help our veterans in honor of them just past Memorial Day and the upcoming of D-Day? With missing files. Instead, let's process them. Mr. Speaker, I yield back.